India has crossed 50,000 cases. Sanket, as we said, now this has been a rapid doubling in the last week that we've seen, and this is when we were hoping that the curve would flatten, but these numbers coming in not encouraging at the moment.
Absolutely. The numbers are rising, and one will often ask this question of the government, if there were a briefing today, which it wasn't, why is the curve not flattening? And that is going to be a very significant question to ask, because if you take a look at the rate with which these numbers are rising, this is a bit of concern. Through the course of this broadcast, we are going to deep dive into data to tell you how soon are we adding the 10,000 figures. The latest that we are hearing is that this remarkable or steep rise has been happening over the past 2 to 3 days. In fact, there was a day where we added only yesterday 3,900 new cases. Today has been, and we'll eventually know whether it has been more than 3,900 or less, because that will show some sort of a trend. But first, let's quickly take a look at the states. The highest spike has happened in Maharashtra today with 984 cases. That in Tamil Nadu is 508, in Gujarat 441, in Punjab 218, and Delhi continues to see that upward trend of 206. Punjab is an alarming figure because cases are increasing dramatically. So this may appear small in terms of total contribution, but these numbers are increasing dramatically, and the doubling rate in Punjab is very high.
In fact, Sanket, also looking at those numbers, what's interesting is that the lockdown seems to have worked in slowing down the initial rate. But as we are seeing now, that as we are relaxing the lockdown and restrictions, that's the big worry, that when you're relaxing, cases still rising, what do you actually do?
Well, Sonia, most of these reports that are coming in are of the period of the lockdown. That's how COVID-19 works. The real impact of the easing of restrictions and its impact on COVID-19 numbers will actually come 14 days from now. So I don't know whether we should read too much into this, because if we do, then there will be an even sharper rise, and that will be a cause of worry. I'm not trying to be alarmist, but let's quickly take a look at these numbers. The fewer days to cross to 50,000, and we are going by a chronology, as Sonia mentioned, the chronology or the sequence of the first case being reported to the 50,000th case that has been reported, the number of days that we have taken to add. So from 1 to 100 has been in 45 days, from 100 to 1,000 in 14, from 1,000 to 10,000 only in 16. Then take a look at how we are adding the next 10,000. From 10 to 20,000 in 8, 20 to 30,000 in 7, 30 to 40,000 in just 4, and 40,000 to 50,000 in, ladies and gentlemen, just 3 days. So if this trend continues, Sonia, this is a cause of worry for the government. But see, I don't know, maybe this could have been a lot worse had lockdown not been in place.